Hello and welcome to blackdoctor.org. I'm Shamika Rhymes. It is Black Maternal Health Awareness Week, and today we're focusing on this critical issue that's affecting our community. According to the CDC, Black women are nearly 3 times more likely to die from pregnancy-related complications than white women in the US. And that statistic alone is enough to stop us in our tracks. So today I am joined by Thana Hickman, founder and CEO of Viola's House, a national organization that provides services for underserved, homeless, and pregnant teens. And she's also a powerful advocate for maternal health. Welcome, Thana.
Thank you. Thank you for having me.
And then Nicole B is also joining us. She's a mother who lost her 26-year-old daughter due to pregnancy complications. Welcome, Nicole.
Thank you.
Now, this is a super, super critical, like I mentioned, topic for, especially though I've seen so many stories on social media just during Black Maternal Week already, where a lot of Black women are sharing their stories. So, Thana, you've been a vocal advocate for Black maternal health. What inspired you to take on this issue personally and professionally?
So I became a vocal advocate after I started doing the work and just saw the disparities with the Black women with healthcare and maternal care. I started Viola's House first as a mentoring program and immediately saw the need for housing with teen mothers, that they faced homelessness when they became pregnant for various reasons. And so I started the maternity home in one apartment with 2 beds 10 years ago. And one of the focuses since starting has been the social determinants of health, knowing that if we can focus on all of the things around that wheel of food, housing, transportation, access to healthcare, economic stability, education, then we'll see better outcomes in our communities with the Black maternal mortality rate and the infant mortality rate by focusing on all of those aspects, which are the social determinants of health.
So that probably kind of answers my second question of what are the root causes behind some of that maternal mortality disparity for Black women in this country. I think.
Yes. And the root causes is one, we are more at risk when we enter into the healthcare system than any other demographic, especially with our maternal needs, just due to the fact that a lot of Black women have a lack of access to things that they need that focus on the social determinants of health. And so when we enter the healthcare system, the training is implicitly biased against Black women. And so we see the disparities in the numbers that we're seeing with Black women dying at a much higher rate because our healthcare is not really set up for us. We have so many risk factors that are considered when we go into hospitals to give birth. And a lot of times, as you'll hear from Nicole, we aren't taken seriously. Our complaints are deemed as us just complaining. And by the time we find out what is really going on, a lot of times it's too late.
Yeah, I just read there was a story on Instagram actually where someone was talking about just the gaslighting that went along with there's something wrong, and then it could have been handled early on, and then it just dragged on, and then the baby was born really early. So with that being said, Nicole, can you share your daughter's story? And when did you realize something was wrong? What steps were taken? What happened? And thank you again for being here and being so courageous to share the story.
Thank you for having me. November 27th, just a day before Thanksgiving of 2024. Um, my daughter, she had given birth on November 18th to her her third child, which was a boy. Um, she complained the following day of chest pains, which the nurse told her at this point, that's normal after having a baby. And no, ma'am, that's not normal. Um, I worked for the same hospital that my daughter passed. So I was very into it. I was there for everything. They did not give her an EKG or chest x-ray. They sent her home on the 20th. By the 24th, she returned back with the same chest pains alongside with nausea and diarrhea. And they ended up keeping her, said she had a mini heart attack and pneumonia. Um, those days, she ended up in ICU. By the 27th, I walked in the room, seeing my daughter sitting on the bed, rocking back and forth. And it lasted for a good 10 minutes while I was in there trying to figure out who is her nurse, who's caring for her. If she's complaining about chest pains, that's something that you jump to. I work in the ER.
Right.
So they were very slow about getting to her. And when they did get to her, they injected morphine, and I feel like it was too fast. And within 3 minutes, she was gone. So now I'm just, my grandkids are motherless,
Yeah.
So
Thank you.
26 years old. So
Thank you for sharing that. And again, I am so sorry. I am so
Thank you.
sorry. Um, Donna, how do you have statistics that can speak to that highlight the urgency of this maternal
Yeah.
health crisis?
Yeah. So we know that in the US right now, 50 in every 100,000 births that Black women have, 50 women die, which is alarming because with other races, it's 18. Um, it's a much higher rate, right? And Nicole's story about her daughter Tiara is one of the best examples. 92% of maternal deaths happen postpartum,
Mhm.
meaning after a mother has given birth. For people who don't know what postpartum means, it is after birth. And so 92% of those deaths happen because there are complaints that are unheard. There are things where mothers are telling the healthcare system what is wrong with them. One of the popular stories out here, Serena Williams, where she tells about her complaining, and she knows for a fact that she would not have gotten the proper help if she was not Serena Williams.
Mhm.
So it happens way too often. It doesn't matter your social economical class. You have to research and educate and know what hospitals provide the best maternal care. I literally just had a grandbaby 6 weeks ago, and because of my education and because of me advocating for this and speaking with hospitals all the time, I knew which hospitals had nearly zero maternal deaths in Dallas County. I knew where my daughter needed to go. I knew where she needed to go for care, right? And so we have to continue to educate Black mothers on questions to ask your OBGYN, how to advocate for yourself in the hospital. And the second you feel any pain, what you'll learn about a lot of these stories is that there is a heart attack attached to it,
Mhm.
which means we need to be asking for chest x-rays and EKGs, right? And you are owed that. They cannot tell you no if you are asking for it. That will reveal an issue immediately. If your heart stops, your life is over.
Mhm.
So when we want to find out, how do I advocate for myself? Your heart cannot stop. That is the first thing that you need to advocate for. So many factors. Women develop blood clots after giving birth, right? A lot of women don't know this, but if you're experiencing issues, they can take you right into an OR and do a DNC to make sure your uterus is completely clear so there's no blood clots that travel to your heart.
Mhm.
So many things that I have learned on this journey just from servicing these mothers, from researching, from doing the work, and understanding the root cause of it. And let's be clear, the root cause of it is racism, right?
Mm-hmm.
So the only thing that we can do nothing about racism, but we can advocate and we can educate ourselves. And that is what Black mothers have to do right now.
Mm-hmm. I think storytelling is definitely a huge part of awareness, right? And so, Nicole, I'm so grateful that you were open to sharing your story. What made you want to be vocal about your daughter's story?
Want it to stop. Um, I want our pain to be noticed. I don't want us to always look like we're strong. Oh, they can handle it. Because yes, we are strong, but our hearts are weak.
Mhm. Right. Yeah, absolutely. Where has this advocacy journey taken you so far, Nicole? Like, have you, um, what does that look like for you?
Healing
Hmm.
is helping me to talk more and to make people better aware of what's going on in our community and raising noise for my baby. I lost my baby due to
Yeah.
mishandling, so
Hmm.
negligence.
Mm.
Yeah. Thana, if you could ask for one change in the
Mhm.
system today to save another mother's life, what would that look like? What would that be?
The first change that I'm going to ask for to save a mother's life is changing the healthcare training.
Hmm.
Yes.
That comes through policy work. We are here in DC right now, and we are right down from the White House at 3 p.m. We are having a call to action event. White House staffers will be here, legislative staffers. I am doing an IG Live right after this with the Congresswoman Jasmine Crockett, because it starts at the very top
Hmm.
with changes to policy, where healthcare training looks different in the United States. We are the only country that are seeing this many maternal deaths, but yet we are the richest country and we have the most resources, which tells all of us that the healthcare training in this country is a major, major problem,
Hmm.
right? And so that's where we start with advocating. I am big on letting the legislators know what's happening in the community, because I am in the community, I office in the community, I live in the community, I serve in that community. I am the voice for the community. Most people won't get to advocate for themselves. I have told Nicole, you have to come alongside of me and tell your story
Hmm.
so that people can really put a face to this issue.
Hmm. Yeah, I agree. I think it is important once you actually see the faces, it becomes more real because, sometimes people need to see that. And I think, Black maternal health awareness, it's not just one week, it's an all year round.
Oh yeah, it
Yeah.
is the work that we do. We serve Black and Brown moms at a much higher number than we do any other race.
Hmm.
And so we have to advocate for the minority races.
Hmm.
Putting a face to it is when Nicole walked into our maternity home with her grandbaby,
Yeah.
the baby that Tiara gave birth to,
Hmm.
who will never, ever know his mother except through pictures.
Absolutely.
That is the reality of generational impact behind this issue.
Hmm.
You have children who have to grow up without their mother. That is generational impact. Nicole is impacted. Her daughters are impacted. And now the grandkids are impacted by
Hmm.
all of this.
Hmm.
It tears families apart because we don't see the change that we need to see in the healthcare system. Because guess what? Most of these deaths are preventable. It's
Absolutely.
preventable.
Hmm.
So,
Yeah.
yeah.
Nicole, what would you say to healthcare professionals that may be watching this who may not realize the weight of their actions or inactions?
Retrain, train, train, train. There is never enough training. Um, yes,
Yeah.
save our babies, save
Mhm.
us.
What message do both of you want viewers to walk away from today after both of you have given such powerful messages today? But what's the one thing you want viewers watching to walk away from? I'll start with you, Nicole.
I can never get my daughter back.
Mhm.
Um, so if you feel if you feel necessary to that the doctor is not doing, ask for another doctor.
Mhm.
Ask for ask to speak to someone that advocates for Black families, social workers, and talk about the problems. That's something I did.
Mhm. Thank you. Donna.
And my message is this is all of our responsibility.
Mhm.
I am my sister's keeper.
Yeah.
Even if you don't have the tools and the resources at your fingertips, educate, share interviews like this, share these stories. You are your sister's keeper. And the baby that she's carrying could be one of our leaders, could do so much to impact this world. And so, again, it does matter because we don't know who this child is that the mother is carrying.
Right.
And so we all need to do our part. This is all of our responsibility.
Mhm.
And I've said it before and I'll say it again. No one is coming to save us but us.
Mhm.
We have to do what we need to do to help save each other. Nobody's coming. There's no plane swooping down saving all the Black women at once.
Mhm.
It's going to take work, it's going to take our voices and education because right now there's nothing we can do about the racism in this country.
Right. Well, how can people reach out to you, Thana, and Viola's house if they want to join in and help like walk alongside you with advocating?
They can reach us by going to our website, www.violashouse.org. You can go to my website, donnahickman.org. Um, there is a GoFundMe for Nicole Berryman to help her support her three grandbabies that this whole family has stepped in now to take care of three kids that are motherless. The GoFundMe is under Nicole Berryman's social medias. And, I'm asking for people to support this family. A lot of nonprofits leaders ask for people to support their organization, but I talked to Nicole and I understand the strain on her family
Mhm.
with three kids that they are caring for now without a mother. And so this family needs support. But there's so many other families that need support. So you can step in at the lowest level. If you can't advocate, if you can't educate, you can't come to DC like me.
Mhm.
You can give your treasure to families like Nicole Berryman. You can give your time to organizations like Viola's House. Come wrap some diapers.
Mhm.
Come help us hand out diapers and get resources into the hands of these families that need it.
And I just want to, just for people watching, so they know how to spell Berryman. Nicole, could you spell that so people will know where to exactly how to spell it so they can help you out,
It's
especially.
Nicole, Nicole, Berryman, Berryman, and the GoFundMe is Justice for Tierra.
Okay, and is that TIERRA?
Uh-huh.
Okay,
Yes,
thank
ma'am.
you. I want to thank you both for coming and talking about such an important topic. Yeah, I'll have to have you back to dig in deeper for a longer discussion. But for more information, everyone, about maternal health, you can also head over to blackdoctor.org. There's a lot of resources and articles there. Thank you again for joining me today.
Oh, one thing to mention.
Yes.
I did just release a book called No Place to Belong. It talks about the social determinants of teen pregnancy and homelessness. In the first chapter is talks about a lack of access to health care. These
Wow.
are real stories of what I have encountered in the maternity home,
Mhm.
and stories of girls to match every single chapter. And the stories are real. So you can also support me by reading the book. In the last chapter tells how you can help be the change that you want to see.
Now, is that available on your website and Viola's Health as well?
Absolutely. Amazon, No Place to Belong by Thana Hickman. It's on Amazon and it's on my website, thanahickman.com.
Okay. Thank you both. Again, this has been a great conversation, and I hope everybody watching is listening. Thank you.
Thank
Thank